Good morning to all of you from Manhattan. I'm David Begnaud, lead national correspondent for CBS This Morning, joining you from my home, where I've done the majority of my reporting for the better part of a week, about a week and a half now. We're doing it from home because we're following the orders of the governor and simply the requests of medical providers to stay home. I saw one meme a couple of weeks ago that said our grandparents were asked to go to war. We are being asked to sit on our couch. We can do this. And so that's where we've been. And if you are a frequent, constant viewer of CBS This Morning, you know that many of us, Anthony Mason is at home, Vladimir Duthier is at home, I am, and some of our other colleagues are reporting from home. So what we wanted to do this morning is we wanted to bring in one of our other colleagues, Dr. Tara Narula, who is a cardiologist and has been very involved in following everything related to the novel coronavirus. And I know a lot of you have questions. Many of them were sent to me. If you are watching this and you want to ask, just type in the comment section below what your questions are, and we can get to them. So let me see if Dr. Narula is ready, and I am going to bring her in. I don't see her yet. I think she's watching. So Dr. Tara, I see you're watching. If you just want to say hi, David, in the comment section below, Tara, I can go ahead and bring you in that way. Okay, here we go. There she is. Boom.
Hi.
Good morning. Good morning to you.
Good morning, David.
Thanks for doing this.
You're welcome.
I would like to start by asking you something regarding an email that you sent to all of us last night. I got up to do an interview at midnight, and
Yes.
I saw this email from you. And look, I'm going to be honest with everyone. Just like many of you watching this are scared from time to time by what you hear and worried. When I read this, it brought about a new level of anxiety, and so I'm thrilled that we get to talk to you about it this morning. Do you mind if I read
Sure.
some of what you wrote to the colleagues? Okay.
I have one in the morning.
Yeah, right. So Tara sent an email that said, interesting preliminary study, needs rigorous peer review, but suggests at some point we may need to expand our precautions from droplet to airborne. Preprint data suggests that viral aerosol particles are produced by individuals that have COVID-19 disease, even in the absence of a cough. That could mean that the virus is getting airborne just by breathing, not by coughing, and we may need to be more aggressive in preventing airborne spread. Can you elaborate on that?
Yeah, so, it's interesting, David. For the longest time that we've been reporting on COVID, we've been saying that it's spread by droplets. So when you cough or you sneeze, those droplets travel out of your respiratory tract and can either land in your mouth, your nose, your eyes, or on a surface. And that those droplets are filled with viral particles that can then cause the infection. There are other forms of transmission besides droplets, something we call airborne transmission, when very small viral particles become aerosolized, meaning they can kind of hang and live and spread in the air, as opposed to the droplets, which really can only travel 6 feet, kind of fall to the ground. The aerosolized particles can have a wider spread, can stay in the air for a longer time. So we've been talking about how COVID is really spread by droplets, but there has been a lot of talk about how possibly there could also be aerosolized forms of the virus that are leading to the large numbers of transmission that we're seeing. So we definitely need more research in this, but certainly this study that I sent out yesterday has not been peer reviewed. So it's important to say that. It's not been published. It's not been looked at by other professionals to say that it's, warrants our acceptance. However, they did find in this very preliminary work that some of these viral particles were in fact aerosolized. And essentially what that means for us is that if that is the case, if we prove that either with this work or with future work, then that would change how we manage patients in the hospital and how we protect our healthcare workers. So we have what we call airborne precautions, where we kind of keep patients in these isolated rooms. You're required to wear the N95 masks, and we're kind of doing that already for these patients. But we're not requiring, in many instances, healthcare workers who are not in those rooms or are not having direct contact with those patients from wearing the N95 mask. Some hospitals are saying you don't need that unless you're actually in contact with these patients or in their rooms. If we prove that, in fact, this is aerosolized and the spread can go farther or last longer, then it may be that in all hospitals across America, every person who's in that hospital, no matter if they're in the room or in the hallway, or in any sort of proximity, should be wearing the appropriate form of personal protective equipment. And in fact, in Boston, the partners hospitals, so Mass General, Brigham and Women's, are already requiring that all staff in the hospital really wear masks. So I think that we're on the brink of learning more and more about this, but certainly it's something to think about. It changes how we think about the nature of this disease if that proves to be true.
So I think any human being listening to you would say, well, how do I protect myself if I'm not a healthcare worker? And Lazy Zabites just wrote, this is why I've been wearing a mask and gloves for 3 weeks, and people looked at me like I was crazy. Now, before you add on, I want to let everybody know contextually, and Dr. Narula knows this. These studies come in when we're not dealing with COVID at various points, and we're cautious as to when is the right time to talk about it, because something that would not be peer-reviewed might be too preliminary, but understand the world that we're living in. Doctors are literally depending on data that is not peer-reviewed, but they have to at least acknowledge it and listen to it because we're in the middle of a pandemic. So contextually, we have to be responsible as journalists, but Tara and I want you to know about this, right? We don't want you to panic. We don't want you to freak out. But am I wrong, Dr. Tara?
I'm glad that you framed it that way, and I actually hesitated even sending the email last night because I don't want to create panic and I don't want people to get the wrong impression that this is a study that was published in a journal that had been peer reviewed. This is very preliminary, and lots of times when we do actually go through that peer review process, we say if there are flaws with the data, this is not a good study, and it does not make it to publication or to something that would change our practice. So, but I agree with you that, when we see these little hints or markers that something might be pointing in a certain direction, we have to pay attention to it. And it signals us that we do need more research into this particular arena for sure.
And so what do we say to those people who say, should I wear a mask any and all times I'm outdoors?
Well, I think you should be staying home and socially distancing. So, that's really the biggest thing to do, is to kind of keep your distance and keep more isolated, as we've been talking about, to flatten the curve. If you have to go out, we have been telling people not to wear the mask because we do have a shortage. We've been reporting so much on the fact that our healthcare workers do not have the proper protective equipment. We talked this morning about how they're wearing cloth masks that people are fashioning for them, in the lay public. So what we don't want to do is to tell people to go running out and start buying up these masks and wearing them. Certainly not before we have data that suggests that there's any benefit for that. And we don't have that yet. So the recommendations are still that the general public should not be buying masks to wear themselves.
And I know those of you watching are in a position like I am. I have a dog and I got to take him out. And that's really the only outing I do. I do not go outside except to take the dog out, but I haven't been wearing a mask. And when I saw that yesterday, and by the way, more context here, the White House is also providing us information that is not peer reviewed, but is coming out in real time. So often you'll hear Dr. Debbie Birx step up to the White House podium and say, she said it this week, we're getting some very concerning data out of France that young people, 19 years old and younger, are ending up in the ICU. That's not peer reviewed. So again, I just want to put a little more context on why we're even sharing this so early. Go ahead.
Yeah, no, and I think it is important to get outside. We can't stay cooped up in our houses or our apartments. You do need that fresh air. And as long as you're taking precautions, you're walking outside a safe enough distance from people, that you shouldn't be exposed even to those aerosolized droplets, you should be fine. So I don't want people to feel like they have to stay indoors. That's definitely not the message.
Do we know how far aerosolized droplets travel?
Well, they can travel farther than 6 feet. So, yeah, I mean, it certainly is something where it could spread farther and longer. Measles, for example, is something that can be aerosolized, and that's why it's so contagious, part of the reason.
Interesting. Okay, I'd like to bring in a question from Tom Holwick. By the way, if you're joining us and you've just joined in, Dr. Tara Narula is joining us. She is our CBS News medical contributor. Did I get that right?
You did.
Okay. My name is David Begnaud. I'm lead national correspondent for CBS This Morning. If you'd like to follow me, it's at David Begnaud. If you'd like to follow Dr. Tara, it's at Dr. Tara Narula, Narula. So Diane asks, if a person had the coronavirus and recovered, do they have the immunity to get it again, or could they get it again?
And that's such a great question, and we've been talking a lot about that because what we want to see and what we're hoping to see soon is an antibody test. And basically that is a serologic or a blood test, just like you get for other diseases like mononucleosis or measles, where they take your blood, they test it for antibodies, and that tells you whether or not you've been exposed or have had the disease in the past. Once you have had a disease, your body produces antibodies to fight it off. Those antibodies stay with you for a certain period of time. So, it depends on the disease. Some diseases generate lifelong immunity, where you get it, you're protected for the rest of your life. Other diseases, you generate the antibodies, but your immunity wanes over time. And whether that over time is 1 year or 5 years or 10 years, that really remains to be seen with COVID. So we know that if you get it, you will definitely be immune for a certain period of time. And we don't know how long that is because we don't have the data. But what the value of that is, number one, it gives us a sense of the scope of the disease in the country, right? So you can test people not just when they're sick, but you can tell how many people have actually been infected. But two, what we're hoping is that for healthcare workers who may have been exposed, infected, and generated antibodies, that would be a safer population to deploy into the workforce to help treat patients with COVID, because they won't presumably get sick again because they have the immunity. So it's a safer healthcare population to utilize.
Talk to us about one of those treatments, because there was a hospital system in New York City that announced yesterday they're going to be doing the process of essentially taking plasma from patients who have built up an immunity. So they were positive, they recovered. So they're taking plasma from their blood and actually putting it into the bodies of people who are suffering. Tell us what that process is like and what it is for.
Isn't that amazing? So this is something that's been used before. It was used with Ebola. And the idea is, yes, if you have had the infection and your body has mounted an immune response and created antibodies, that we can then take your blood and essentially spin it down, take out all the red blood cells, and just leave the plasma, the part of the blood that has those antibodies in, essentially distill that out, and then infuse that after we, sort of made sure everything is clean, into another human being. And hopefully that gives them then the added boost of those antibodies to help them fight the disease off. So yes, Mount Sinai Hospital here in New York is doing that. And it's, it's exciting. It is, the concern is that how scalable is it, right? So how quickly can you roll this out? How many people do you need to actually generate enough plasma to get it to other people? So it may not be a therapeutic that's quickly scalable for large populations, but it's certainly something that could help right now when we don't have a lot of other tools to use to help treat people.
The governor of New York has told hospitals to up their capacity 50% or more. In some cases, he's asking them to do it by 100%. Mount Sinai is one of the health systems that, as of yesterday, started setting up patient pods. I had a doctor send me photos of these patient pods going up in public areas, public pavilions where like the food court is, in order to intake people. And of course, for those of you watching, we included this on our report this morning for CTM, and I posted it on my social media if you want to go see. There was a 48-year-old nurse who worked at Mount Sinai who died. He had, according to his sister, severe asthma when he was a child. But Dr. Narula, this was a case where, according to his sister, he got sick and was on a ventilator fairly quickly and never got off and died. And it's really put a understandable damper within the nursing community at Mount Sinai, which really doesn't have time to stop and grieve because they are so busy just trying to survive with the workload.
I saw your post this morning, and it's just, Every time I read these stories about healthcare workers, either who've been infected or who are scared or who have died, it is truly heartbreaking. And you look at that picture and you look at his text message to his sister that you posted, and I think it really gives a face to this disease to people who maybe think I'm young and healthy and not vulnerable. And I think that's really important, because I think for a lot of young people, maybe there isn't the seriousness around this disease that there needs to be. We are seeing young people infected, and this was a young, healthy person who died. He's a healthcare worker. We are thinking that it's possible that healthcare workers may be at an even higher risk of getting serious infections and dying because of the amount of viral load or the viral particles that they're exposed to. They are maybe seeing a higher dose of those viral particles than somebody who's maybe on the street and gets coughed on. And that higher viral load may cause them to be even more vulnerable than someone else. So, we've been talking ad nauseum about the lack of personal protective equipment and what this is doing to our healthcare workers on the front line. And it's psychologically torment for them to really feel like they're choosing between their job, which they feel they took an oath to do. They're healers, they want to help, and their families and themselves. And it's a horrible position to be in, and not one that people should really have to be put in.
I want to give you his name because I don't want him to be anonymous. I don't want to refer to him just as a nurse. His name was Caius Kelly. He was 48, and Dr. Narula mentioned the text message. He was on a ventilator in the ICU when he texted his sister to say, well, first of all, he said, I'm in the hospital. She said, anything I can do. And he said, can't talk because I choke and I can't breathe. I love you, going back to sleep. And that's the last time they heard from him. I tell you that only because we hear so much about older people, everyone, being the most vulnerable. And there are people who are younger who are dying. Louisiana yesterday reported the death of a 17-year-old from COVID. This is not to tell you that the rules have changed and people should panic when they're younger. It's just to say if you're younger, you're not immune. It's not a guarantee that you're immune. So there was a lady on here, Dr. Narula, who just said, it was a mom, I believe, who was about to deliver, and she said, I'm about to go into the hospital to deliver. Should I be worried?
I think everybody's worried anytime they have to step foot in a hospital. I mean, there's no question that there is concern. I mean, so far, the data that we have has shown that there really has not been transmission from mom to baby during delivery. The virus has not been found in the breast milk or the amniotic fluid, although I have to say this morning I did just read an article about a couple cases in China of women who delivered that may have passed the virus on. But this is, I think, preliminary work, and I haven't had a chance to review the full story. But so far, the bulk of the data suggests that they are not at increased risk of transmitting the disease.
And many hospitals, our colleague Nikki Batiste did a story about how hospitals are not allowing anyone into the delivery room. So mothers are delivering to their baby, delivering their baby alone. My mother's a labor and delivery nurse in Louisiana, and she said right now they're allowing only one person, but you can't, usually like mom will go in, mom will come out, husband will go in, like there's no one coming in or out. So it's definitely a new reality for pregnant women. Tom asks, Dr. Narula, should we make sure our family toothbrushes are kept apart from each other?
I love this question because no one thinks about the bathroom, but that's an area where there's a lot of potential spread of droplets. So yes, you certainly should avoid things like sharing towels, keeping your toothbrushes not touching each other where the potential is to spread those viral particles. Any sort of a surface you should be cleaning and disinfecting, the handles on the sink faucet, the countertop. You just want to really maintain those very good precautions all the time, because the reality is what we've learned is that a lot of people can have the virus and either be asymptomatic or mildly symptomatic and not realize they have it, but they can transmit it. So you may be living with someone who has it and thinks they have a cold or just mild symptoms, and you're at risk of getting it. And then when you get it, depending on your immune system and your vulnerabilities, it could become much more severe. So always good to kind of keep things separate.
Dorothy asks, can you have influenza and coronavirus at the same time?
I mean, they're two different disease processes, so absolutely you could. I think it would be a rare perfect storm for you to get both at the same time, but there's nothing that could prevent that from happening. So yes, it could happen, but the incidence of that is very low.
Dave asks, is there any proof that the coronavirus transfers to our pets?
We just talked about this morning. So there's no data so far to suggest that you can transmit COVID-19 to your pets. However, the CDC acknowledges that this is an area of really limited research and data. So in the absence of that data, if you have COVID-19 or you think you have it, they suggest that you maintain that safe distance with you and your pet, just like you would with another human being that you were concerned about infecting. So that's hard for a lot of pet owners to do, to not want to pet and cuddle and love your pet. But the CDC does say to kind of keep that distance, at least until we know a little bit more.
Are you serious? I hadn't heard that. From your pet?
Yes. And if you have someone else who can, you're looking over for your pet.
Bad news for you, Paddington. Well, he doesn't like to snuggle anyway.
If you have someone in the house that can help take care of the pet, they suggest you use that person. But if it needs to be you and you're sick or you're concerned you're sick, then just wash your hands before or after you interact with your pet.
Somebody in the house to take care of you. Unfortunately, it's only me. I tell people at this rate, only one of us is going to survive the pandemic, and it'll probably be him. Okay, so let's see. Carlos asks, we will soon be in mosquito season. Can the coronavirus be spread by mosquitoes?
No, not that we know. This is not something that's spread through mosquitoes like Zika, for example, or West Nile. This is really spread by those airborne droplets that are, coughing, sneezing, maybe breathing. Yes.
From Anne, I work in a grocery store. I wear gloves, self-provided, and my employer doesn't want us to wear gloves or masks. Am I protecting myself at all costs by wearing the gloves?
Yeah, I mean, grocery store workers and people who really interact closely with the general public are at increased risk, no doubt. And, I think anything that, again, serves as that barrier can afford some protection if you are in close contact with tons and tons of people. So why the person who runs the grocery store doesn't want them to do that, I'm not quite sure, if it's just for appearances. But, you also want to be aware that even though you're wearing gloves, if you're touching things and then touching your face, you can still transmit the disease. So you still can't, you have to be cautious about putting your hands on your face, whether you're wearing gloves or not.
Someone watching this right now just asked, if you have coronavirus, how long are you able to give it to someone else? So how long are you contagious?
Right. That's a great question. So let's just start with, if you're exposed to coronavirus, the incubation period is about 2 to 14 days. So if you're exposed, you will probably have symptoms within that 2 to 14 day window. If you are positive or you have coronavirus, then when can you reemerge into the world? Meaning, like, when are you less likely to infect someone else? We think that the highest time of infectiousness, or when you might infect someone else, is when you have the most symptoms. However, you can also be contagious for the 1-2 days before you have symptoms, which is what makes this virus so tricky, because you may not have symptoms, but you can still be spreading it. So the recommendation at this point is, if you are sick with COVID-19, you need to wait 72 hours till you have no fever. So no fever for 72 hours, off of any fever-reducing meds, a decrease in your symptoms, so things like cough or shortness of breath, and it's been 7 days since you first showed a symptom. Those are really the criteria that the CDC suggests for when you can go back out and potentially not infect other people.
Somebody asked, can the virus travel through the air conditioning?
Well, that's what we were talking about before about, airborne. We don't think so at this point, that it's something that can get into the vents and travel. But obviously, we're learning more and more about this disease as we go.
Larry asks, if breathing is an issue, would using a CPAP with increased pressure help? At the very least, bring it with you to the ER.
Yeah, so CPAP, as you know, is something that people use who have sleep apnea. It continuous positive airway pressure. It basically kind of keeps the airway open and helps you breathe. There's a step up from CPAP, something called Bipap, that we use in the hospital. If somebody is decompensating, their respiratory status is declining, and we don't intubate them, we might put them on Bipap, which again is a big mask that goes over their face and sort of pushes air into their lungs. The reality is, if you're really getting that sick that you're short of breath, you shouldn't really be bringing your machine into the hospital. Again, you don't want it to get contaminated. You need to be evaluated by a healthcare provider who can assess where you are on that spectrum of need. Are you somebody who needs just nasal cannula oxygen? Do you need Bipap? Do you actually need to be intubated? So I definitely wouldn't self-diagnose and self-treat. I think if you're concerned that your respiratory status is declining, you really need to get to a hospital where somebody could assess you.
What are some things that you want to point out?
I think other than the struggle that the healthcare workers are facing, which I can't emphasize enough, and the reason I emphasize that is not only to bring awareness to what they're dealing with, but also to just drive home the message to people about staying home. I read a quote by a doctor in San Francisco at UCSF who said, social distancing is the greatest call to altruism. And I think it's really hard for us to function in that way where you're doing something, you're not seeing the benefit, but you're actually benefiting the greater good. And that's really what's going on here. The more you can socially distance and stay home, the more we can flatten the curve and decrease the overload or surge that our hospitals are going to see. And obviously here in New York, we're seeing it already. And so I think even though it's hard to do, it is really important, number one. Number two, I want young people to know that they can be vulnerable. They need to take precautions as well. So those are really the main two messages.
Many doctors have canceled elective procedures. You do cardiology. Have you canceled your procedures?
So, well, my husband's a plastic surgeon, and he had to close his office. So, yes, all elective surgical procedures at this point are not happening. I'm a general cardiologist, so I don't do procedures, but all of the interventional cardiologists who do are only doing them in cases where someone's having a heart attack or they're having what we call unstable angina, or really emergent procedures. And even in my office, we are limiting the number of patients we're seeing to just those who really urgently need to be seen. So all of my regular routine follow-up patients have been called by my office, who is now pushing them back at least 45 days or more to be rescheduled. And that's where, yeah.
Go ahead, love.
I was going to say that's where, telemedicine can be beneficial. Yeah. And my office is using that.
I was just going to say, I had a follow-up with a doctor, and they called yesterday to ask me if I was interested. And I said, I'm really fine. You should give that appointment to someone else. So are you doing some telemedicine stuff?
I just got an email yesterday and talked to my office manager that they're rolling that out in my office next week. And they are asking us to, learn how to do it, and whether it's a phone call or a video, that is a service we'd like to provide to our patients, because it's hard. I mean, as a provider, it's hard for me to just say bye to my patients for 45 days or more. So, you want to maintain that connection. You want people to feel that they have their primary provider available to them.
Somebody on Instagram just asked, can we talk about the symptoms? We've heard about shortness of breath. We've heard about the dry cough. We've heard about the fever. Well, we've also heard people presenting with symptoms such as diarrhea and abdominal pain, and that which is not consistently associated with the symptoms. So are the known symptoms sort of expanding in terms of what we know?
Yeah, again, I mean, this virus is new. It's new to all of us. It's new to humans. We're learning about it day by day. And so certainly I agree. The main symptoms that we talk about are the shortness of breath and the cough and the fever. But you're right. You can have, in some cases, gastrointestinal symptoms. So nausea, loss of appetite, diarrhea. We just talked about the newest one, which is really that loss of smell or taste. Anosmia is what we call it, and that is maybe another marker of this disease process. So I think we're just going to continue to kind of get a bigger picture of what this virus looks like and how it can present in humans over the next couple of months.
Dr. Tara Narula, thank you for taking the time just to answer some questions. Appreciate it.
Thank you, David. Always a pleasure.
Yeah, nice to see you. Okay, everyone. Well, thank you for joining us. We will do it again and consistently as we move forward with our continuing coverage of the coronavirus pandemic. Listen, our objective, our goal, and our intention is to provide you the most up-to-date information in the right tone with all the necessary context consistently. So we give you our word. Have a good weekend. I'll see you again Monday on CBS This Morning.